Okay, so the title of my talk is How Can Synthesized Evidence Help Reduce Poverty? I didn't call it Can Synthesized Evidence Help Reduce Poverty, because I firmly believe that it is by using rigorously synthesized evidence that we will actually help improve both policy making, program design and program implementation. So I should make some acknowledgements to Radhika Menon and Kanika Jha, Radhika, Kanika, both 3IE colleagues at the back who helped me brainstorm about this presentation, so thanks guys. So just to clarify quickly, what do we mean by evidence synthesis? So what we generally mean is a systematic collection and presentation of evidence on a particular topic or program. We don't mean literature reviews, and what I'm going to talk about are, whilst they may have conceptual similarities to literature reviews in that they draw their secondary studies based on evidence, so they're primarily desk-based work, they necessarily use rigorous methods which are clearly documented in a study protocol. So I will talk about gap maps, systematic reviews, and statistical meta-analysis. I'm not going to talk about rapid evidence assessments. Perhaps some of the, perhaps we'll have some discussion of that in the sessions after the break. On the other hand, so you know, I work at an organisation, and I have been doing a role where evidence synthesis, drawing on results from multiple studies, is the essence of informing policy and practice. But we also know there's a lot of problems with the current evidence syntheses and evidence synthesis movement more generally. The first one is that studies often don't answer relevant questions for decision making, so they can be quite narrowly based either on particular interventions, particular outcomes, or particular types of evidence. The second point is that frequently you will see things like this in reports, which is generally quite far removed from the types of information that policy and programs need in order to take action. And finally, studies frequently take ages to do. So when we look back at the history of 3IE systematic reviews and meta-analysis program, for example, the average study probably takes around 2 years, although we're reducing the numbers and we're currently estimating somewhere between 12 to 18 months. But 12 to 18 months is the minimum amount of time for a decent quality systematic review. So, for example, furthermore, why do I just want to focus quickly on evidence synthesis informed rather than merely evidence informed? So as you saw in the opening exercise, there may be very good reasons why you would draw on single evidence, single evaluation reports to inform policy, particularly if that evaluation report is on the specific policy which of interest. So, for example, if you're conducting an impact evaluation in order to scale up a government program, then you may well simply just draw on that single piece of evidence. However, when we want to make assertions about broader policy making and programming, we want to draw on broader evidence. Whilst it is frequently the case that most policy communities, I think it's fair to say, certainly when I was in Rwanda, I'm fairly new to India, but would be what you might call an evidence-free zone. And when we do try to bring decision makers, policy makers into more evidence-informed thinking and away from opinion-based thinking, frequently, the first thing they do is they will draw on single studies. They will find a single study that supports a particular prior notion, and they will run with that. Sometimes, actually, a range of evidence will be used, but again, it's not clear how systematically collected that evidence is, and therefore how representative that evidence is of the wider policy debate. And finally, frequently, the quality of evidence that includes evidence from impact evaluations, including randomized control trials, is often not actionable. So let's take a case of a very currently policy relevant case in India. What should the government do about NREGA? Should it scrap it? I mean, I've read many opinion pieces about NREGA. I'm not sure what they were based on. It didn't seem to be evidence. They certainly weren't citing evidence where people were calling about scrapping NREGA last year. Or perhaps the government should improve it. And if they are to improve NREGA, how should they go about that to make a difference to poor people's lives? And I think that we can help answer these questions by drawing on rigorous evidence from multiple sources and from multiple disciplines. And that includes evidence which has been collected over long periods of time. So here's it's probably quite a typical quote from a management consultant. Generally, apologies to any management consultants in the room. Generally, their job is to put people out of work. So this chap says that NREGA is an absolute disaster. This was actually an opinion piece on the web. On the other hand, Jean Drez and colleagues says that the factual basis of the NREGA debate has made it possible for extremist positions to flourish. So what is already out there? What do we already know about NREGA? So there's a rather brilliant synthesis study. It's not a systematic review, but it's a synthesis study commissioned by the Ministry of Rural Development called the NREGA Samiksha study. This study is a collection of some 260 documents, which they posted online subsequently. Now, this is not a systematic review. It was published 2 years ago, so it is out of date. But it is a useful source of information. But we all know there's a long history of Indian employment guarantee programs. So actually from ancient times, if you do some exploratory research on Wikipedia, you'll read about the Artha Shastra, which advises a good king should institute the building of forts or waterworks with the grant of food. This was in about 150 before Common Era. In the modern day, the employment guarantee schemes essentially started with the Maharashtra EGS scheme, which provided a which became legally a rights-based approach from 1979. And there's various programs, the JRY, the EAS, the Samporn Grameen, the SGRY, and now the NREGA scheme. All of these programs experimented with different ways of doing employment guarantee schemes. So potentially, there's a lot of evidence that we could draw on, not just from current implementation of NREGA, but also from the past 50 or so years. So what I'm going to go on to talk about are evidence gap maps. Evidence gap maps are a new approach that have been developed by 3IE. They're essentially a systematic literature scoping exercise which is then presented in a way which is user-friendly. And by user, I mean policymaker and researcher. And what we've been working on over the past few months is a evidence gap map on NREGA. So gap maps are thematic evidence collections on programs which might be a range of interventions. So we might think of different interventions to promote sanitation, or it might even be on a particular program, as in the case of our gap map that I'm presenting today. and they use a framework to present a matrix of policy-relevant interventions, as well as process intermediate outcomes and/or impacts. So some gap maps, it's a bit like doing any kind of synthesis product. You determine the scope of your study based on the interventions and outcomes you're particularly interested in. And what I'm going to present is a gap map where we've looked right across the causal chain, not just at outcomes and impacts from impact evaluation studies, but also at process outcomes from studies which collect other broader quantitative and qualitative evidence. So this is just to help you to understand the way that we've set up the outcomes part of the gap map. So how is one of the ways in which evidence synthesis can be useful is to basically help us understand complex programs. So we all talk about theories of change and different types of outcomes. So NREGA is a particularly complex program because it covers both the demand and the supply side. So it both promotes local government to generate the projects which create the labour demand, and it also promotes uptake of NREGA by poor and needy beneficiaries. So we can think of three different types of governance outcomes: democracy, decentralisation, and corruption. We can also think about three different types of livelihoods or economic outcomes, so direct, both direct and indirect for beneficiaries, and also indirect outcomes on the broader economy. If anyone saw Shiv Kumar's presentation on Monday, you might think of these in terms of constitutive effects and consequential effects. And then finally, we have empowerment outcomes, so outcomes for women, children, and other disadvantaged groups. So to move on very quickly to the findings from the study. So we have some 260 studies, I think, which are covered by this evidence gap map. These studies, when we look at them by we've basically broken down the studies according to the location in which they're conducted and also other factors. So if we look at the studies by state, we can see that there's a relatively large numbers of studies in the top three states, so particularly Rajasthan and Andhra Pradesh, which is about, if you look to the far right, you can see the studies which have been conducted at the nationwide level, and the tallest bar is all of these states which have smaller levels of numbers of studies than those listed here. When we look at, so we can see that the evidence is quite concentrated in particular places. It's very likely to be those places where implementation was in the early phases. And secondly, in those states where good data are already available. But that is not only the case. We look at the outcomes, we can see that we have some 40 or so studies, 50 studies, which actually look at direct outcomes from NREGA. So in other words, poverty outcomes, income levels, and consumption. But we see very few studies which have looked at empowerment outcomes. These are studies which use impact evaluation methodology, in other words, studies which attempt to quantify what difference is made by the NREGA scheme for beneficiaries and the broader economy. But also, we've collected a lot of information on the broader process and implementation evidence. And this just shows the breakdown according to access to the scheme, issues relating to wage determination, the physical assets created, the performance of implementation, and broader governance. So what we essentially have is
performance means in terms of what?
implementation. So implementation by the state, and so local government, central government. So what we end up having for every single state, and this isn't available online yet, but it will be, is a evidence map. Now the evidence map is essentially a matrix which looks at process on the columns axis. We have process and outcomes, so basically evidence along the causal chain. On the vertical axis, we call them interventions. We basically have different aspects of the NREGA scheme which are being tested or on which data are being collected. So which would include both the labour demand, labour supply, and studies looking at the entire programme in totality. And in the middle bit is the evidence and the gaps. Okay, so this is actually Andhra Pradesh is the state with the second state with the most numbers of studies. It's very hard to see here. There are relatively large numbers of studies. There are very few, and this is a more general point about this evidence base. There's very few impact evaluations. If we look at Meghalaya, essentially we just have a gap. I think there's about 3 studies. So whether or not, now I'm not an expert on the Northeast, whether or not, but it's my understanding that NREGA at least nominally is being implemented nationwide, and so there are certainly states with very little data availability. When we look at the rigorous counterfactual studies, by which I mean the experimental studies, the RCTs, and the quasi-experimental studies, but also simulation studies. Don't forget that we're interested in outcomes for the broader economy and society. What we find is, again, we have some 23 studies nationwide for a program which is reaching millions of people. And these studies are use varying methodologies. Okay, so that is a very brief overview of our evidence gap map. I'm going to just quickly mention what the potential uses of gap maps are, what they can do, and what they can't, what I don't believe they can do. So a gap map, you can do it in depending on the scope of the study, in 1 to 3 months. So it provides a quick overview of the existing evidence. And mainly this can provide recommendations for research, whether that is a systematic review of the evidence, as we're planning on doing at 3IE, or simply advising research funders on opportunities for future evaluations. It's possible to do I presented a gap map of primary studies. We do have gap maps of systematic reviews. Indeed, this is where 3IE's gap maps program started. Those types of studies can provide general policy guidance because they summarize and appraise the systematic review evidence. But gap maps of primary studies are not able to do that. And why is that? Because essentially they don't quality appraise the evidence and they don't synthesize it. They just present it in a summary matrix and a report, as I've done. Finally, gap maps are intended to be global public goods updated periodically. Okay, so systematic reviews. In fact, so for a gap map, you don't provide any appraisal of the evidence. All you say is what kinds of questions you think that evidence can answer, but you don't say how valid and reliable that evidence is to answer that particular question. So on the other hand, systematic reviews, because you do provide that appraisal and that synthesis, you can provide guidance for policy, for programs, possibly for implementers, certainly for research, and finally, you have a global public good, depending on the nature of the review. So systematic reviews, though I was very pleased that most people got the answer right to the question on systematic reviews. So most of the questions weren't right or wrong answers. That one was. Systematic reviews can be answered can be conducted to answer a very wide range of policy relevant questions, and not just on the typical questions relating to intervention effects, drawing on impact evaluations, but also how programs are designed, what are the factors determining implementation success and failure, what stakeholders' views and experiences are about programs, and of course, how efficiently do programs turn inputs into outputs, cost effectiveness. So you can have systematic reviews on any of these topics. If any of you wants to download our Farmer Field Schools report, you will see a systematic review covering 5 of these particular questions for that global evidence base. So let's look at, in a bit more detail, at the Swachh Bharat program. So we know that I mean, this is absolutely massive topic, not just in India. This is massive globally. So half the world's open defecators are estimated to be in India. And it is suspected that there are major implications for right across a range of outcomes, including child mortality, nutrition, and other factors relating to poverty. So the objectives of the program include, they're not limited to, but they include eradicating open defecation, improving toilets, behavior change, and awareness raising on public health. So when we look at theories of change about fecal-oral disease transmission, this is the F's diagram. Most people in the room will have seen this. And we think of the different sanitation and hygiene interventions as breaking the cycle of disease transmission. So in the case of sanitation, we expect that to break the cycle from shitting to drinking fluids, to groundwater, fields, and also flies. So, and similarly, on the other hand, the sanitation. So, in theory, we would expect sanitation to break these disease transmission barriers. However, there's just providing sanitation is unlikely to actually have an impact. And why is that? For two reasons. The first reason is that there are threshold effects, which is a fancy way of saying that if I shit in my garden and you're my next door neighbour, sorry, forgive me, and you're my next door neighbour, your children can still become ill, so you need to cover an entire community. And the second reason is of course, because of hygiene. So people actually need to observe hygiene practices, particularly around hand washing. So we actually need evidence to provide answers to do such programs work. And here is if you haven't seen one before, this is what's called a PRISMA flow chart, which is a systematic search flow diagram. And this is I've actually amalgamated 2 systematic reviews that 3IE's funding on wash sector interventions. Typically, the flowcharts will show you that we searched somewhere around 50,000 records, and we included somewhere around 200 studies. So it does sound like a lot of information is being thrown away. Actually, if you look at this search flow, you'll see that the vast majority of those 50,000 are irrelevant studies because search has cast the net widely. But we do have 2 reviews coming out which examine 2 aspects of the WASH evidence literature. And I should say that these are reviews of global evidence. So unlike the NREGA gap map, they include evidence from any low and middle income country. So the first review looks at what are called counterfactual impact evaluation studies. So I'm going to assume that after 3 days at evaluation week, you know the difference between a counterfactual and a factual study. Maybe that's a foolish assumption. Counterfactual studies are essentially the impact evaluations, RCTs, quasi-experimental studies, simulation models. It tend to be quantitative studies. On the other hand, we have a second systematic review which looks at what we call factual evaluation studies. So factual studies are studies which don't contain a counterfactual, i.e. they don't measure something in relation to what would have happened without it. They just provide, be it qualitative or quantitative information relevant to a particular question. And I just wanted to talk quickly about hierarchies of evidence. So I would imagine, and certainly when I came to systematic reviews, one of the first things that I was taught, and I think somewhat erroneously, was that there are universal hierarchies of evidence, and that has RCTs at the top. And I think once you actually think about the different types of questions that we want evidence to answer, there is no such thing as universal hierarchy of evidence. There are hierarchies of evidence for particular questions, which might have RCTs at the top, but for other types of questions might have qualitative studies at the top. Okay. So what is this systematic? These are some preliminary findings from the systematic review. What does the evidence from India's past experience of sanitation programs have to say? So we have evidence from the Total Sanitation campaign in both Orissa and Madhya Pradesh, both of which studies have shown, and these are cluster randomized control trials, so they're the best quality evidence to answer the impacts question. Both of these studies suggest that not only were there problems in implementation, so you only actually see modest increase in access to latrines, but there are also issues relating to the use of those latrines, and neither of these studies estimates any statistically significant effect of the access to sanitation on disease outcomes or indeed any other outcomes. Does this mean that sanitation doesn't work? No, it doesn't mean that. And importantly, this is the reason why it's important to look at the process outcomes to be able to say whether the failures of programs in improving outcomes relate to the failures of the intervention itself or failures in implementation and adherence and uptake. There is evidence also from national hygiene campaigns conducted elsewhere, so evidence in Vietnam, Peru, and Bangladesh. Once again, these are scaled up programs, but importantly, these programs use essentially fairly standard approaches to hygiene education. So they're none of them are CLTS or triggering approaches. And again, once again, none of these programs, when they conduct programs at scale, see impacts on outcomes. So the conclusion that we're reaching is that, and this may be quite obvious to some people, but that supply doesn't create its own demand. It may not be obvious to others. The findings that there's a fair amount of theoretical studies which have been conducted and to elaborate and explain this these phenomena. We see that reductions in child disease rates are either the problems with promoting health education and for behaviour change is that reductions in disease rates are either not observed by children's carers or they're not considered substantial enough to warrant costs in terms of either money or time in taking up the intervention. Second of all, we know that adoption of innovations is generally slow. So if you read Everett Rogers' Diffusion of Innovations, you'll see that generally adoption is a generational process. There are some new interventions, such as the community-led total sanitation program, which are trying to bypass this and trigger widespread, very fast adoption through disgust as a mechanism. There simply aren't studies which have measured outcome, which have used impact evaluation methods to measure outcomes. And we also know that it's people's perceptions of benefits which are important. So the user satisfaction for women and girls, time use and safety. So we should expect that facility maintenance in the longer term will be important in determining sustained adoption. Sorry, so this is one of the slides from the systematic review that we're about to release, which looked at the qualitative evidence and basically it looked at these different periods of the project, so early project period right to down to a late post-project period, and talked about the reasons why the projects, why essentially sustained adoption doesn't happen. Okay. So we're almost at the end now. We have about 3 minutes left, and I've been told that I can't go over at all. I guess I have to move very quickly on to the final program, so the Jandhan program. So why am I talking about this program? Because I wanted to talk about microcredit. So, those of you that I'm sure will be more familiar with Jandhan than I am, but the ultimate aims are to eradicate poverty, and so I've read empower women. And the question is, will such a program help to empower the poor? Will opening bank accounts, giving women access to savings, credit and insurance, eradicate poverty and empower women? So I can't answer all of those questions, but I can at least provide some evidence on microcredit that suggests that just providing access to the overdrafts is very unlikely to empower women. So we've recently published a systematic review on the effects of microcredit. Again, it's a global systematic review. There's in some areas like NREGA, where there's lots of evidence, you know, it can be useful to look at evidence for a particular country or region. In general, we find that there's quite a lot that can be learned from casting the geographical scope more broadly. That study includes 25 impact evaluations, most of which found a positive and statistically significant relationship. So I think if we just were to say, let's count up how many said yes, how many said no, then we would have concluded that, yes, microcredit is empowering. However, we don't conclude that, and I'm sorry for those of you that would like a quick lesson in statistics. I'm not actually going to provide it to you, but the reason being that all statistical evidence, so evidence from impact evaluations, has an associated confidence interval. And when we report whether a study had an effect or not, it is always with respect to that confidence interval, and in particular whether that confidence interval overlaps 0 or whichever is the point of no effect. And so most impact evaluations, it turns out, even those that claim to be adequately powered, simply don't have a sufficient sample size to detect statistically significant changes. That means that most impact evaluations are going to conclude there is no effect of the program, when actually it's very likely that the sample sizes simply aren't sufficient to estimate a statistically significant effect. And that is the value of meta-analysis. So, and it's also the value of just replicating studies and doing multiple studies. So statistical meta-analysis or statistical meta-analysis is data pooling and synthesis across studies. So the study is the unit of measurement, not an individual within that study. And it involves aggregating samples and findings, measuring and controlling for bias, exploring heterogeneity in findings, and testing for other things like publication and reporting biases. So I do want to show a forest plot. Do I have enough time to show a forest plot, please? 2 minutes, yes. Okay, so this is a forest plot. It doesn't have very much information on it yet, but we're going to build it up from the ground up. So a forest plot essentially shows evidence from particular studies or programs, and it shows evidence for all of those programs which are included in an analysis. So it's basically a visual way of looking at the statistical information. So in a forest plot, just like any graph, we have a origin, which is indicated by the vertical line, and we have that indicates our point of no effect. And what we're measuring on the horizontal axis is empowerment in microcredit programs. So to the left of the origin, we have less empowerment. That is, women who received credit, who are part of credit groups, are less empowered than women that aren't part of credit groups or that don't receive credit. That's importantly equivalent women, not. And finally, women, those to the right, are more empowered. So what this, if you can see it properly, shows is one study for India. So we have the horizontal line showing the 95% confidence interval. We have a point estimate of minus 0.01. So in this case, we would say that this microcredit program, I think it just overlaps the vertical line. So we don't find any statistical evidence either way for whether microcredit improved or reduced empowerment for those women. And then at the bottom of the forest plot, what you see is a diamond, and what the diamond estimates is essentially the pooled effect. That is like the average effect looking across studies. So here is the meta-analysis of rigorous study evidence on microcredit. Now, by rigorous, I mean good quality experiments and quasi-experiments. You'll see that these studies have been conducted across regions, so both Africa and Asian countries are included. And what do we see? We see an overall effect, which overlaps the origin, the null effect line, which suggests that overall we don't see any benefits from microcredit on women's empowerment. Women's empowerment here is measured by the women's share of control over in household spending decisions. But we can also, because we have a forest plot, we can actually look at particular programs, and we can actually look at the two Indian programs. And again, actually the Indian evidence is broadly reflective of the overall evidence. So the implications of this study, and this is a study, remember, that just looked at impact evaluation evidence. It didn't go more broadly. The implications of this study are that they don't find any evidence that microcredit programs affect women's empowerment as measured by their control over decision-making, household decision-making, spending decisions. And therefore, you'll have to read the study to find out why they did some additional theoretical analysis. They state that therefore it's very unlikely that there are any broader empowerment benefits. So there are some tentative conclusions for policy which I've put. You'll notice that they're given in question marks because we simply don't have the evidence on this, and we urgently need evidence to answer these types of questions. For communities about women's position, we can discuss that in the next session if you like. Okay, so I think that's it really. I'm going to be yanked off the stage soon. Evidence synthesis should use rigorous approaches. Users should be involved, and findings should be communicated effectively. So here's some more slides. We were going to have an exercise, but we're not. Thanks.